Okay, hi, it's Dr. Buford here. We're just getting started on the left knee. We're looking in the medial compartment. Everything that you see is magnified about 30 or 40 times on the screen. This is just a little bit of an injury to the femoral condyle on the medial side that we're looking at here. Just want to make sure it's not unstable. Seems to be pretty stable, so we're not going to mess with it. As we look at the posterior horn of this meniscus, it looks pretty good, and we can see the articular surface of the tibial plateau actually looks pretty good too. So right now we're just taking our time flushing a bunch of water through. Hold this camera. Just flushing a bunch of water through the knee just to clear things up a little bit. We've already harvested two very nice hamstring tendons, and so now as you get a better look towards the back, use your push down on the knee, like kind of where the post is. Yeah, so as you get a better look here, we're seeing that this meniscus is actually checking out pretty good, I think. We're going to get a good look in the back before we make a final decision. And if need be, we'll use a probe also, but so far so good. So far so good. So we'll go off on the video for a minute. Okay, so this is the central part of the knee where the ACL is torn. And we can see here that there's really nothing left. See how there's no ligament here? Completely torn. We can see all the way to the back. We haven't really shaved anything but the ligamentum mucosum, so this is really how we found it. We're going to go ahead and remove the remnant of the ACL here in preparation for placing a nice new graft in. And as you can see here, there really isn't much to remove. So we're going to go ahead and work here on this lateral wall just to make sure we have enough room. We sized your graft and it's a size 8. And so we just want to make sure we have 8 millimeters of space. We'll keep working here. Okay, so I want to give you an idea of what we're looking at here on the lateral side. So this is the lateral meniscus, and so far we're seeing a little bit of a tear here, but you can see the way it's torn. That's not a repairable tear right there. That's just a little thin split. Actually, it's a double split. There's 2 splits in it. And so getting out the first split, we'll see if the second one is repairable. Okay, so we'll stop there. We'll put our shaver back in. I'm going to just pause for a second. Okay, here's our decision. This meniscus has a bunch of splits in it. And man, I really hate to take that out because that would involve taking all of this down. You can see we're right at a part of the knee called the popliteal hiatus, which means that if we take this down, you're going to have a gap in the meniscus from here all the way back to here. And so we're going to think about some options here for you. I think there's a couple other tricks we may have. Okay, we decided to go ahead and place one stitch around posterior. That's what we call kind of a hay bale stitch. It's using a device called the Novostitch from Smith & Nephew, and it's a nice option in these situations where you don't have much to suture with, so it is my preferred option in these situations. Just wanted to give you an idea of what the device looks like. We have a laser line there. That allows us to kind of judge where the needle comes out. And for this type of stitch, we're going to go through about like that. And then I'm going to get another stitch a little bit farther back. We'll show you some more in a minute. Okay, so we placed that second stitch there, and that's holding that meniscus together. I'm hoping we're going to get some healing response there. But that's, I think, the best way to try and save the meniscus for you here. So we're going to finish up with that lateral meniscal repair. I'm going to irrigate a little bit. But you can see when I turn on the suction, the meniscus is stable. A little bit of bleeding later on, once we get you back to recovery, will actually help that start to heal. We're going to look at the patellofemoral joint next. And so as we look up here at the patella at the top of the screen, it looks good all the way out to the lateral side. We can look down the lateral gutter. Looks great. Come up here, we can look at the trochlea all the way down to the front of the knee. Looks great. The medial gutter over here, also clear, suprapatellar pouch clear. So we're going to get to work on making some tunnels and doing the rest of this ACL reconstruction. Okay, so I want to show you what this graft is going to look like. That's the graft in position there. And as we move the knee, you can see how the graft tucks in there nicely. It's angled towards the back of the knee like it's supposed to, and I'm happy with the way that looks. I'm going to flush the knee a little bit. Okay, so now we're going to finish up here. This will be the end of the video because there's nothing else to show you. Everything else is going to be outside the joint. But I really hope this does the trick for you, okay? Good luck to you now. Bye-bye. Just one final look at the graft as we flex the knee. Great.